I'm Charlie Rardin. I'm a member of the Division of Urogynecology at Women and Infants Hospital and the Alpert Medical School of Brown University. This presentation is based on the publication entitled Effect of Bothersome Overactive Bladder Symptoms on Health-Related Quality of Life, Anxiety, Depression, and Treatment Seeking in the United States, Results from EpiLUTS, published in the journal Urology in 2012 by Ian Milsom et al. Pfizer Inc. provided funding and editorial support for this study. This presentation was developed and produced with funding from Pfizer Inc. EpiLUTS, or the Epidemiology of Lower Urinary Tract Symptoms, was a population-based, cross-sectional survey conducted in the United States, United Kingdom, and Sweden to evaluate the prevalence and symptom-specific bother of overactive bladder, or OAB, and other lower urinary tract symptoms among adults greater than 40 years of age. In addition, the study evaluated the impact of OAB symptoms on health-related quality of life, or HRQOL, work productivity, mental health, and sexual health. Results from the EpiLUTS study indicated that in the United States, 27% of men and 43% of women have OAB symptoms sometimes, and 16% of men and 33% of women report having OAB symptoms often. The current analysis was focused on assessment of the level of bother associated with OAB symptoms and impact on HRQOL, anxiety, depression, and treatment seeking among adults in the United States, a subpopulation of the overall EpiLUTS study. This publication presented data for both men and women. However, the results presented here are focused on women. EpiLUTS was an internet-based survey with electronic invitations distributed to potential respondents between June 5th and July 8th, 2007. The survey included a total of 106 questions evaluating 1. Prevalence of lower urinary tract and OAB symptoms, 2. Frequency of and bother associated with individual symptoms, 3. Bladder-related and generic health-related quality of life outcomes, and 4. Healthcare-seeking behavior and treatment. The presence of urgency was assessed with the question, during the past 4 weeks, have you had a sudden need to rush to urinate? The frequency of urgency was rated with a 5-point Likert scale, including never, rarely, sometimes, often, and almost always. The presence of urgency urinary incontinence, or UUI, was captured by asking participants whether they leak urine in connection with a sudden need to rush to urinate. Survey participants were asked to rate the extent of bother for lower urinary tract symptoms using a 5-point Likert scale, not at all, a little bit, somewhat, quite a bit, and a great deal. Integration of the responses for urgency, UUI, and bother-related questions produced 3 respondent subgroups: no or minimal OAB symptoms, OAB at least sometimes without bother, and OAB at least sometimes with bother that was at least somewhat. Outcomes measures included the patient perception of bladder condition, a 6-point Likert scale for severity of bladder-related problems, and the 13-item OAB questionnaire short form HRQOL scale. Overall perception of health was rated with a 5-point scale, excellent, very good, good, fair, or poor, and the medical outcomes study 12-item short form questionnaire with physical and mental component summary scores. Anxiety or depression were assessed with the Hospital Anxiety and Depression Scale, or HADS, which includes 7 items each related to anxiety and depression. Subscores greater than or equal to 8 indicate possible clinically relevant levels of these mood disorders. Regression models were used for evaluating predictors of OAB bother and treatment-seeking behavior. As noted above, reported here are EpiLUTS survey results focused on adult females in the United States. Data are reported for 7,057 women greater than or equal to 40 years of age, including 2,496 with no or minimal OAB symptoms, 1,479 with OAB without bother, and 3,082 with OAB and bother. Women with no or minimal OAB symptoms were slightly younger than those with OAB, with or without bother, 55.6 versus 56.6 and 57.9 years, respectively. Overall, HRQOL was significantly lower for women with OAB, with or without bother, compared to those with no or minimal OAB symptoms, according to the OAB questionnaire short form HRQOL. HRQOL scores were significantly lower for women with OAB and bother compared with the other groups. Results from the patient perception of bladder condition illustrate the impact of OAB. Compared with women with no or minimal OAB symptoms, or women with OAB without bother, a greater percentage of those with OAB with bothersome symptoms reported minor, moderate, and severe problems associated with their bladder condition. OAB with bother, 27.7% some minor problems, 29.8% some moderate problems, 7.5% severe problems, and 2.1% many severe problems, versus 15.6%, 5%, 0%, and 0% for OAB without bother. Aside from 14.5% who reported very minor problems, none of the women with no or minimal OAB symptoms reported minor, moderate, or severe problems. The physical and mental component summary scores of SF-12 indicated that women with OAB had significantly lower scores compared to those with no or minimal OAB symptoms, and women with OAB with bother had the lowest scores compared with the other groups. 19% of women with no or minimal OAB symptoms rated their overall health as excellent, compared with 8 and 5% of women with OAB without bother and OAB with bother, respectively. Hospital anxiety and depression scale scores associated with possible clinically relevant anxiety and depression were highest for women with OAB and bother, compared to those with no or minimal OAB symptoms and OAB without bother. Women with OAB and bothersome symptoms had a mean of 6.0 healthcare visits in the previous year, statistically more than women with OAB without bother at 4.5, or women with no or minimal OAB symptoms at 3.2. 27% of women with OAB with bother sought treatment for their healthcare provider for urinary symptoms, compared with 13% of those with OAB without bother and 4% of women with no or minimal OAB symptoms. Pearson correlations between OAB symptoms frequency and bother were determined for urinary urgency, urgency urinary incontinence, and nocturia. Among women, the strongest correlation between symptom frequency and bother was urgency, followed by urgency urinary incontinence and nocturia. Limitations to the study should be noted. Data collected from the EpiLUTS study are cross-sectional, and temporal cause and effect relationships should not be ascribed between OAB symptoms and health-related quality of life, anxiety, depression, and healthcare-seeking behavior. The survey methodology relied upon self-report, which should be considered in the interpretation of the study results. Pharmacotherapy was not included in this analysis, and therefore the impact of pharmacotherapy on the results is unknown. Data from the EpiLUTS study indicate that for women greater than or equal to 40 years of age in the United States, the symptom burden associated with OAB is significant. Women with OAB and bothersome symptoms report lower health-related quality of life compared with peers with no or minimal OAB symptoms or OAB without bother. Anxiety and depression may be increased in women with OAB and bother relative to these peer groups as well.